Okay, this is your ABCDE assessment, and this is going to be your opportunity to do a hands-on practice of a particular scenario that I will give you once we go through our rules and regulations, if you will. So we'll be in this room here, and I hope everybody understands that this is a learning opportunity. There is no judgment. We are not to go back to our nursing units and, can you believe what Lorna did? She should have been smarter than that, those kinds of things. We will not operate that way. Okay, when we come out to debrief, we will talk about what happened, and everything's confidential. Everybody okay with that? Mm-hmm. All right, so that's a big thing. What happens here stays here. And we're going to be professional. You want to treat the mannequins as if they were real people, including if they are alive, they will have pulses. If they are not alive, they will not have a pulse. They will not respond, those types of things. Okay? All right. That said, you do have to be a little bit of actresses, right? These are not real people, and if you ask them to move their feet, they're probably not going to do that, right? We only have certain things we can make a mannequin do. Okay, so far so good? All right, so I'm going to give you your scenario, and I want you to think about the ABCDE assessment, down and dirty, right? Because you may potentially be in a situation where even if you encounter, the patient needs an IV, for example, depending on your scenario, you may not be able to intervene at that time. Either you don't know how to start IVs, which is fine, not everybody does that, or you might be in the patient's bathroom and you don't have an IV box and tubing and that kind of thing. Okay, so that's just an example. All right. So your scenario is you hear gunshots. Okay, you hear 6 gunshots. And that's really all you know right now. So I am here to tell you the scene is safe, all right? Normally, I would encourage you to run the other direction, right? We're going to watch the video, Run, Hide, Fight. But I'm going to tell you for purposes of learning that the scene is safe, okay? So you hear gunshots coming from your patient's room, right? When you enter your patient's room, the scene is safe. You're almost dealing with a little mini mass casualty. There will be more than one mannequin in the room. So far, so good. All right, so I need you to, as a team, kind of do a quick assessment, figure out what you're dealing with. If your mannequin's alive, they will have a pulse. If they are not, they won't. Okay, so you have to think a little bit more trauma. Looking at my ER nurse. If they do not have a pulse and you've got more than one patient, are you going to start, cardiac arrest procedures? The answer is no. Okay, good. All right, so you want to take care of, unfortunately, in this day and age, you want to take care of the person that is salvageable. All right. So this is a little bit graphic. We will definitely debrief when we are done. If you feel disturbed or need to talk about that, that will definitely be your opportunity to do so. So your learning objectives are, number 1, you're going to perform the ABCDE assessment. So just real quick, remind me what those all stand for.
Airway, breathing, circulation,
exposure. Good. All right, so then you're going to manage each of your assessment findings. Okay, so once you've assessed airway, if there's a problem with the airway, you need to address the airway within your capabilities before you move on to breathing. Okay, if she's talking and saying whatever to you, have you pretty much addressed airway and breathing? Mm-hmm. Moving on. Okay. Questions on that? Right? So you're going to perform it, you're going to address it, and then you're going to apply what you're doing in here to your work environment. I want you to kind of think about the scenario that I'm going to give you. And we'll talk about that during the debrief. And then once I tell you the scenario and you see what you're dealing with, you're going to recall a little bit of an additional assessment that you learned in your modules. And I'm kind of smiling under my mask, and it'll all make sense once you get in there. All right, so your scenario is all you know is you hear gunshots. Normally you'd run away. I'm telling you the scene is safe and you can go in and that's your scenario. You don't really know what you're dealing with yet. Okay, but think ABCDE assessment. Questions? Any questions? You know what you're going to do? You're going to walk in the room. I know you're not going to have 7 people there to help you, but you're going to just kind of assess the situation and hit it, intervene. Start with airway. Figure out who's salvageable and take it from there. Okay? This is trauma. You're kind of flying by the seat of your pants because you really don't know what you're walking into. Ready? All right. That's the door. The scene is safe.
Hello. Hi. Alright, we got a lady with some blood. Oh, okay. Sir, you okay? Looks like we've got some bleeding on the floor here. We've got a weapon. Ma'am, no, ma'am, can I help you? Looks like we've got. Oh, okay. Do you have any oxygen?
Does this one have a
We need to
pulse?
stop the bleeding right here.
No pulse. Is he breathing?
Do you have any pulse?
Okay.
Ma'am,
So
ma'am, are you with
she's-
us?
Can we leave it flat?
So we can
Mhm.
move it on.
No. Do you have a pulse?
Does she have a pulse?
No, we don't have a pulse.
No pulse on her? No pulse. Not breathing. Okay, she would
Coming
be
right over
deceased
top
as
you.
well. Or he.
She's pinked up now.
Okay, alright.
Alright.
Oh, okay. How many babies are in there?
Okay, so she has a pulse. She's breathing. Okay.
How pregnant are you?
Okay, so we'll keep her calm. We need to assess for her injury. So where is she shot at?
Take her shirt off.
Get her off. Where's her? Okay, so.
Access, where was the access?
Okay, so let's roll her.
Should we maintain C-spine maybe?
It can't hurt. We don't know the extent of the injury, so we can't.
Okay.
Okay,
On
well,
line
let's,
three?
so
Okay.
she has a bad injury to her right arm, so let's roll her to her left.
Okay. On my count. 1, 2, 3. 1, 2, 3.
The other left.
You're going the wrong way.
Oh.
You're going the wrong way.
Well, she has an injury.
Where's the other
Right
injury?
there. Right here. I'm holding.
She's
holding
holding
pressure.
Okay, so she has a wound
We have
on the
two
left
injuries.
thorax. Where's the other one?
Right here that I'm holding pressure
Okay.
I don't think it should be rid of the left then.
Well, her arm's completely deformed to the right. Or her right arm's completely deformed, so I would roll her to the left
She's also
because her left arm's not as injured.
to. Oh, maybe the left side.
I think
Yeah,
giving her
because she's
left will be
pregnant.
better.
Do we have a pillow that we can just maybe pop her?
Okay, any other injuries on her back?
So I don't see any other injuries.
Miss Noel, you're gonna be okay.
Okay.
I don't feel good at all.
Oh.
Okay. What's the matter? What don't feel good?
This is the worst pain ever. This
Okay,
is the
so
worst
one
pain
injury,
ever.
right?
Yes. So far, one injury noted.
Okay, bleeding's controlled.
There's 2 injuries. Her arm.
She's awake, she's talking. Where's the pain at?
I've been shot. My baby.
Okay, we can end scene.
Okay.
Great. All right, if you want to go back out to your seats, I promise you this wouldn't take long if you did it right. All right. So, how do you feel about that scene?
That's scary.
Scary? Okay. Any other thoughts?
It is challenging because you're walking into confusion.
Yeah.
You really don't know what is being presented, and your mind is racing on okay, what should we do? So, yeah, that was a first instinct. Okay, fine. I'm looking at her and thinking about all these things in my head. I know what to do fast.
Good. Thank you. Did anybody else sort of struggle with what do I do?
I feel like you would have called a rapid or a code of some kind so that there's already an organizational plan in your head anyways, rather than just, I understand why you're going to go in there, I get all that. But why you would have, knowing then the people would have a basic understanding of at least chain of command,
Defined roles. Type of
defined
thing.
roles,
Mhm.
instead of everybody is the same, is on the same level when there doesn't seem to be a structure to it, I guess.
Mhm.
You know what I mean?
I agree.
I
I agree.
ran into codes that are exactly like
Yeah.
that, where they're not your patient and you have no idea what's going on.
Yeah, right.
I
I
think
think
also,
it's-
sorry, go
the-
ahead.
It's, there were 7 of us walking in the room, so it's kind of go in, kind of pair off, see the patients. But if this was just you seeing 3 patients, yeah, you're going to triage them, check on all of them, but who do you check on first? You go to the one right next to the door? Do you go to the one that was the bloodiest? Who do you
Yeah.
do the ABCs on first if you're by yourself?
Right. And I have a feeling you're not asking, you're stating, like, yeah, what,
Who do you?
I think for me it was where your resources were, because our sickest patient, or the patient that needed our attention the most, she was at the least convenient space in the room. She was not by the oxygen. She was not by like the bed with pillows where we could, we had to get that pillow to her, where she was kind of up against the wall. So things like that, it was just not convenient for the team where she was.
mhm.
'Cause
So
imagine if we had to move her out of the room, we'd have to then get her on a backboard, get her up, and instead of just wheeling her onto the OR type of thing. Just like thinking ahead and
So you work in the emergency department, so you're sort of in tune to that whole thinking ahead. How did the rest of you feel? Were you able to anticipate, what you could do, not having, any resources at all to like medically manage this person?
I just thought in my head, because she's pregnant and she has a baby, she's like, bleeding. We are concerned, of course, for the patient. Now we have 2 patients. We have mom and baby, and of course, losing all that blood and being shot, we really don't know the extent of the injury. We could give some supplemental oxygen just to also, help with the baby. That's why I was crying for like a bag, like just something oxygen.
Mm-hmm.
I guess I was
That
just
process.
thinking access more than anything, because she said she was bleeding, like we were gonna have to do that massive transfusion. If we were gonna delivery, we were gonna have to start oxytocin type of thing. So like access was my kind of thing, because outside of oxygen, you're gonna need access to give her anything else medically.
Good. So you were thinking ahead and anticipating while you're doing your ABCDE assessment. Good. So what do you think worked well? We had
Teamwork.
planned for Christopher to kind of be the team leader. So I didn't hear what you said. I'm
I
sorry.
said teamwork.
Teamwork? Okay. What else worked well? Or do you feel like it was a total disaster?
No, I think Christopher did a good job in terms of leadership, trying to guide. Okay, fine, let's do this. There was one voice that was guiding us into, the next step, and we were all in agreement about that. So I think that was something that worked
Also,
well.
like people saying what they saw. Like I didn't realize she had that thoracic injury until others, and then that deformed arm. I wasn't like processing that until people said it, because they were like next to that area. So
Mhm.
just like communication and speaking clearly.
Yeah, communicating what you're seeing, because not everybody's able to physically see that side. Good.
I think we did a good job not lingering on the deceased patients. So I know sometimes you're checking for a pulse, and they say you wait 5 to 10 seconds. It's like, sure we don't feel one? Are we sure they're not breathing? Because instinct is to help everyone. So I thought it was no pulse, not breathing, and we just, as mean as it is, you just move on to the next.
Yeah, and that's something that definitely would throw any group of nurses off. When you've got 3 patients and there's only one that you could possibly help, the other 2 are obviously dead. That is very anti what we're used to. Yeah. So, would you do anything differently next time? You mentioned, call rapid, something like that.
You need a cart,
Oh,
because
Okay.
there's nothing in there to really do much with.
Right.
I think, like after making sure the airway was clear, it sounds like, but I would probably want to take all the clothes off immediate to see where, the injuries were. Cause you could see blood, but we were all kind of looking well, we weren't really sure where it was. And then, once someone said, take the clothes off, and it's like, okay. So I think that would be a instinct to just like, okay, everything come off so that you're able to see, assess like, you know, where the injuries are and see a little better.
Well said. And obviously, with 7 nurses in the room, things are A, B, C, D, and E. Things are going to happen at the same time. It's just the way we operate. So well said. You know, somebody's going to be getting her clothes off while, you know, somebody's checking for a pulse. It's just the nature of the business. So
Maybe, do you think adding like, probably yell out, maybe, I don't know, within the scenery, because she's pregnant, we would want to involve like OBGYN, like, you know, if they're in the house or something like that, because she's pregnant and we can clearly see, like, you know, that she's the baby.
mhm.
But in
Just
that
like a-
situation, I know as morbid as this sounds, your number one concern is the mother's life, irregardless of the. Because if she doesn't make it, then the baby inside doesn't make it.
Right. So you're correct. You're thinking ahead.
Uh-huh.
But as far as that rapid
like-
A, B, C, D, and E,
Mhm.
he's spot on. I mean, the mom's the vessel,
Mhm.
you know.
Okay.
So down the road, like Shadia said, you know, absolutely, we're going to get OB-GYN
Okay.
involved. Absolutely. Good comments. All right. Does anybody want to summarize your personal experience? Like you two have been especially quiet, putting you on the spot.
Like from that.
Yeah. Like what's going through your mind right now?
I mean, I get what he says. The baby's not the first priority, but it is and it isn't because the baby, depending on how far along she is, could still survive. But definitely flipping her on her side was one of the priorities, like of her being pregnant, for sure.
Good. Why did we turn her on her side because she was pregnant? Do y'all remember?
What's that called?
That,
So
spinal cord
supine,
compression or
yeah.
something.
Uh-huh.
Yeah.
Right. Right.
It's
Right.
oxygen, so.
So good.
I think another thing too is trying to troubleshoot without always relying so much on the patient's response, because in those situations, like she's just like, my baby, and we're like, well, where are you hurting? You know what I mean? Instead of like keep asking her, we could have maybe took more time to look instead of like asking her, because she wasn't really, you know, sometimes they're not even able to answer you. So it's like being able to try to find those things out without trying to ask the patient so much, if that makes sense.
Yeah. Mm-hmm. Good. 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 All right. The big question of the morning. What did you learn or see or do in this scenario that you could apply to your work area? So, for example, you find your patient in the bathroom who's on a blood thinner that's cracked his head off the sink and he's now on the floor. Like, what have you learned here that you could apply to where you work?
As small as it sounds, I would lower them down.
Okay,
I mean, if they're
lower
in
them down.
that sitting position, yeah.
Mhm.
And assess.
Okay.
Airway, breathing, circulation.
So what'd you think about the gum? Were you expecting, like, we talk about airway all the time, right? Did you really think there'd be something in her airway?
No.
Oh, I didn't see that.
Yeah.
that was good.
Ah, so interesting. You were with the other patients. Okay. Yeah, she had no patent airway until they removed her chewing gum that she had aspirated. So good. And then her cyanosis went away. So what else will you think? So good. You'll definitely look in the airway next time, won't you?
And then I was kind of hesitant to even put my fingers in there and grab it, because I'm like, I don't want to stick it further
Yeah.
down. And then so I'm like, should I grab it? Should I not? So right.
What else? What do you think you learned from this scenario that you could apply for the rest of your nursing careers?
Triaging, focusing on the patient that's most likely to survive.
Triage? Yeah, which one's going to survive? Now, I would hope, for the love of God, that you would never, never have a situation like this. But in today's, environment, it's a possibility. So yeah, triage. You really, like Christopher, you stated, sometimes you really do have to step over the people that you know are not going to survive and help the ones that are. Anything else?
I think somebody has Like if you're the first person in, usually that I'll just start yelling at people to get me this, and this. No, I didn't do it that time, but I mean, at times that it was real. Like somebody has to take charge, otherwise it's just a big
chaos.
cluster.
There has to be set rules, or it's just gonna be chaos.
So Christopher, we voluntold you to be the leader. So if I may ask, what are your thoughts?
I thought it went well. Everyone kind of went in, did their thing. We did the ABCs on everyone. The 2 patients that were deceased, we're like, okay, we assessed them, moved on. And then we focused all our attention on the 1 patient we could save. The only thing I thought of, and it's a minor detail, when she kept saying my baby, I wanted to ask her, how far along is she? Because is this she's 5 months pregnant, and she's just worried about the baby, or is it she's 9 months pregnant and that situation, stress might have sent her into labor? Because we would have handled that situation a little bit differently. The fact that she's pregnant, I don't jump to, that doesn't make me jump, that doesn't make me panic. But if it was she's in labor and she's shot, that's a whole different ball game.
Does change the scenario a little bit, doesn't it? Thank you. And that actually is a perfect lead-in to my final question. If you think back to your obstetrical module, it was so long, we had to make it parts 1 and 2. So in a trauma situation, there are 4 key questions, and actually you just named one of them, questions that you would want to ask once we know her A, B, C, D, and E have been taken care of, which you all did a very nice job. Very nice job. What are the 4 key questions? So you said the one is, how pregnant is this woman? Is this a viable pregnancy? Or is she only 5 months and there is nothing we're going to do to save this baby no matter what? Okay. What are the other 3? How many babies are in there? Just coming back to you now? Right? If she would go into labor, I would want to know if there's 1 baby in there, or are there going to be like 3 coming out? What else? What else do you want to know in the heat of the moment? Any drug use, right? And I think I talked about it in the module. We're not talking about, did you take Tylenol today, right? I need to know if I'm going to have a baby delivered, bless you, that's going to be drug addicted. Okay? And then the 4th question, a little awkward to ask any female. 4th question.
What's coming out?
Yeah, what's coming out of your vagina? So a little awkward. You can tell this is our ER nurse, right? And somebody's going to look eventually, but you want to see, do I see a head? Do I see an arm? Those kinds of things. Do I just see a lot of blood, which there should not be if she's in labor? Do I see something flesh-colored and pulsating? Maybe she's, got a umbilical cord prolapse, those types of things. However, I do want to take you back to the whole trauma scenario and remember that ABCDE is always going to be your priority. So anything else anybody wants to add? Comments, questions?
So was this a murder-suicide, or like with a gun?
Yeah, murder-suicide. So again, I apologize for a horrifying scenario, but you all did very well. Anything else?
It happened, right? I think I read about something like this. Was it in Texas hospital?
Yes.
I think so. Yes, it happened. I remember it in the news. There was something about there was a husband and the wife, and he ended up like shooting. I think it was the wife. He killed himself, and of course he shot the nurse before he killed himself. I think it was like a real life in Texas.
So I hate to say this. This has actually happened a variety of places. This is not a completely uncommon.
I had a woman that was CMO, and her whole family was in there, and I was talking to the husband, or not her son, like the whole time for maybe an hour. I didn't realize that he had a gun strapped under, and I didn't see it the entire time until one of the Hucks noticed it. So after that, now I do a scan of everybody in the room. Even though his kids were in there, grandkids were in there, and he's walking around. I didn't see him.
Which begs the question, how do you get into the hospital with that?
He walked right into it with it. He walked right past security with it.
Yikes. Good eyes. You heard me say multiple times on the modules, we've got to be detectives. And y'all did very well. Very well. Any other Final comments, questions?
Thank you for a wonderful morning.
Oh, you're welcome. It's not even over yet. But it will be soon, I
Yeah.
promise. All right, if you think of anything else, come find me. If you were in any way disturbed, again, this is a private, confidential area. We're not going to talk about this scene when we go back. Come find me after we're done today. If you feel like you need to talk, this can be a disturbing kind of thing. So my hope for you is more an application of the patient that's on a blood thinner, falls in the bathroom. I want you to think back to your trauma training before anybody else comes to help, or you're dealing with anything past A, B, C, D, E, and you're just in that 30 seconds, like, what am I dealing with here? Where are my injuries? Okay, everybody get the idea of why we did this? All right. Thank you.